That was it.
Just one more minute. YouTube is just still setting up, and we'll give you the go ahead.
There's a message saying meeting is now streaming live on YouTube.
Okay. Okay. We're good to go. I'll hand it to you, Glenn.
Well, it's October 12th, 2021. We're here at the Board of Health of Northborough. We're going to take a roll call, and then we'll go through the colloquially. Present, Dr. Jane.
Present.
Dr. Jane.
Present.
Dr. Sane.
Present.
Dr. Sane.
Present.
Capobianco.
Present.
And I, of course, am the illustrious attorney Glenn French. And leading the health agency is Dr. Black. Dr. Black, I'm going to ask you to inform the public of the procedures regarding this meeting.
Great. Thank you, Mr. Chair. So again, Kristen Black, health agent for the town of Northborough. I'm just going to read the script that allows for us to meet remotely. So this open meeting of the Northborough Board of Health is being conducted remotely, consistent with Governor Baker's executive order of June 16th, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded, so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Thank you.
Okay, well, we'll begin the meeting with minutes from the last meeting. Has everybody on the board had a chance to review them? Are there any comments, suggestions from the members of the board?
I've reviewed them and I don't have any changes.
Nope.
Nope.
Good. Dr. Jane?
Yeah, so this is just for completeness sake. I know at the last meeting I said I would like to be consistent, like Dilip Jain, as opposed to Dr. Jain. However, in one of the paragraphs, and I don't know if it's worth mentioning from that standpoint, where the resident had voiced her concerns and then we got back. So it's the third paragraph down after Ms. Chapin, the next paragraph. Glenn French said that we must work with the science that we currently have. Dilip Jain and Swati Sane both stated they have not heard the information that Ms. Chapin shared. I don't know if it's important to state that we are both physicians in that particular statement. Otherwise, why,
Right.
Why is that brought? You know what I'm saying? I guess
Yeah.
from that standpoint. So why is our opinion being stated there and not, Teresa's or your opinion? You know what I'm saying? Just from that standpoint, only from completeness standpoint, to close the loop, so to speak. That was the only thing I found in that one. Whether or not we should mention that both are physicians.
Yeah, you could add in neither of the physicians on the board, Dilip Jain, Swati Sane, had, how's that sound?
Yeah, I think that would make
Clarifies
sense there.
that. Yep.
So somebody's reading it, they say, well, who the heck are these two people that,
So moving forward along
Sure.
that topic, I spoke to Katie today about we would update, maybe just moving forward on clarity, your point, Dr. Jane, about, whether or not we're putting titles throughout the minutes, that will put anyone's credentials in the who's in attendance. So it will be,
Correct.
Dilip Jain, MD, and then maybe just to move forward for consistency, meeting minutes again, we'll just use throughout the body of the minutes, we'll just refer to the last name if you're comfortable with that, and credentials will be listed above.
I'm totally fine with that. Only where it's necessary, like in that particular sentence, I think it's helpful. So if somebody, layperson is reading that, then, it's like, okay, Dilip Jain could be a garbage man, but we're going to believe his science.
I was gonna go all
Don't want
formal
that
this
to
evening,
occur.
but now I'm gonna go back to first name basis. Okay,
First name basis?
first name basis. Okay, well then, if all the board members are fine with the minutes, except for the aforementioned change, I move that we approve the minutes from, insert the date here, please, as recorded, except for the one change noted. Let's see. All those in favor, let's delete.
Aye.
Teresa,
Aye.
Swati.
You're muted,
Swati,
Swati. You're muted. You're muted.
Yeah, okay. Aye. Sorry about that.
was that an aye?
It was an aye, yes.
Okay, good. Then minutes from the last meeting are approved. And we're gonna return back to Kristen, who will tell us what's on the agenda for this evening.
Thank you. I'm going to share a presentation. I'm hoping this is going to view okay for everyone. I did change the slide size because I know this was a problem before. Does that work okay for all of you? Can you see that cleanly?
Yes.
The presentation? Okay.
Yes.
Great. So again, just to go over the agenda, we're through the minutes. Thank you. We're just going to talk briefly about our flu clinics that are planned for this upcoming Friday, Saturday.
Yeah.
I'll give you a brief COVID update talking about clinics for COVID-19 clinics, testing, case counts, any other business, and then we'll be establishing a tentative future meeting date. So let's see. Okay, so right into flu clinics.
Okay.
Oh, you're breaking up a bit, Glenn.
I can't help it. I didn't grow the, oh, there we are. How's that better?
Okay. Okay, so we have our Northborough Senior Center Flu Clinic is scheduled for Friday, October 15th. So this Friday from 9 a.m. to 11 a.m. So again, this is supported through our Greater Boroughs Partnership for Health and our contract with Salmon VNA. So there'll be 4 Salmon VNA or 3 or 4 Salmon VNA nurses there, including Erin Shanahan, our in-house nurse, administering flu shots to Northborough seniors and municipal employees. I think currently we have 64 of the 100 or so appointments booked, so there is still availability. We're encouraging our seniors to book online. We have it's a tinyurl.com/nboro, so NBORO clinic. Is the link, or they could also book through our lovely health department staff. Katie and Angie have been helping people through this registration process. It's pretty simple. Again, there's no co-pays required. We do ask for people to enter insurance information when registering, and we're using that same color registration software we're using. So again, appointments are required. Wear short sleeves, wear face covering. It's at the Northborough Senior Center. Again, and it's this Friday from 9 to 11 a.m. We'll also be holding our Northborough, sort of a larger flu clinic this Saturday at the Algonquin Regional High School, so 79 Bartlett Street. That clinic is open to any Northborough and Southborough. So this is the first time we've really joined forces on offering a larger flu clinic. So all Northborough, Southborough residents and employees ages 6 months and up. So this clinic again will be run, so it's just the one day. So for those younger kids, for the doctors on the board, we won't be doing the boosters, but we'll be able to do the first shot at this one clinic. Again, same thing, appointments are booked online, the tinyurl.com/nboro Clinic 2. We'll take you straight to that link. We also can help you if you want to call the health department. So the fun thing with this drive-through, we're sort of testing this out. We haven't done this before. Other communities have been very successful with drive-through flu clinics. You can vaccinate the whole family. You don't have to get out. We are planning for 8 vaccinators, 4 lanes of traffic. I'll show you that flow. So we should be able to get people right in and out of there and let you get back on with your Saturday morning events. So again, this is 9 to 12. Again, this is supported through the Greater Boroughs Partnership for Health. The Salmon VNA nurses will be there. They're the ones purchasing the vaccine. And then we have actually 6 volunteers that have stepped up through our local CERT and MRC teams to help vaccinate at this event. That gives us the 8+ vaccinators we need, and a huge support to make this happen with our Department of Public Works that will be out there setting up tents, lanes of traffic. We're going to do a lot on this setup, and I'll show you on that next slide. So again, appointments are required. Everyone should register in advance, wear short sleeves, face coverings again, even though it's just outside of the vehicle. We'll just try to be respectful of our vaccinators. Don't come if you're not feeling well. Most important, leave those pets at home. The one thing we found with other communities that run the drive-through clinic, the dog that's leaning his head and jumping to try to get at the vaccinator doesn't really help the situation. So we want to keep everybody safe. So leave your pets at home. And we also are teaming up with the Northborough Fire Department. There will be a drop box for new, I wrote clean, I should put new unwrapped toys there for Toys for Tots. So again, we're trying to make this a larger community event. There's over 300 shots available, which is great because we've heard of some local nursing associations that haven't been able to get their hands on vaccine, and luckily Salmon ordered early. So we do have 300 shots. I think we have around 184 booked. So we have over 100 vaccine appointments still available. So really want to make this a big success as our first Northborough, Southborough. And I just want to show you briefly the traffic flow here. So we're putting a lot of time into this. We've ordered special signs. The whole goal here is we're really testing out and our emergency dispensing site plan for an outdoor. Hopefully this model will work well. The public will like it, and we maybe transition and use this for a 5 through 11 COVID-19 vaccine clinics if and when they'll become available, or even for booster shots. So this is a quick sketch here of Algonquin. This is our little property. So this main drive, this blue arrow coming in, is the main drive. There'll be plenty of signs as you arrive. You're going to turn right. So you're not going to the main entrance of the school. You turn right, there'll be signs all along. You're going to take the longest way around. And then you'll queue up, and we have 4 lanes of traffic. So there'll be tents set up between lanes 1 and 2 and 3 and 4. We'll also have a 3rd tent that's set up. So for those squirmy toddlers that maybe won't stay still in the car, we'll have them pull over to a safe location. We have a children's tent if needed, and we can get out and do a more traditional, sitting in a chair for a young child that might be anxious to get that shot. So we're looking forward to that. We don't have a required observation period for this unless someone hasn't received the flu shot before. So we will have individuals pull off to the observation area. But unlike COVID-19, if you've had the flu shot before, there's not a required observation period. So that's what we have on our flu clinic. So before I move on, did you have any questions about these upcoming flu clinics?
Just a comment. I think that Saturday there's the PSAT too. So around noon there will be a lot of traffic between 11:30 and noon.
Yes, it's a tough weekend. That's a good point. Actually, they approved me and said you're good, and then I get a call from the school said, by the way, we have the SAT. So the PSATs will be taking place in the gymnasium. So we're not going to be in the building. They are going to request that anyone taking the PSAT is either parking in the upper lot towards the front or in front of the main lot. But there will be no parking for those SAT students. They'll be walking around. Luckily, they can get there, and we won't stress them out because they'll arrive long before we start this. But again, they're going to be in those upper parking lots and not coming around. And then to further compound this, homecoming is the night before. So we work with the police department to make sure that that lot is going to be cleared that night, like 11 p.m. So a couple extra obstacles, but I think in terms of timing and weather, we couldn't strike it better for the balance of getting that flu shot in that wonderful month of October, avoiding Halloween weekend and trying to fit it in. So the schools have been great to work with, and hopefully all those SAT or PSAT kids will be safely parked in the other areas. So we'll be there early at about 7 o'clock with DPW's help and making sure those areas are clearly marked off.
A couple of things. It'd be great to give the students coming for PSAT their flu shot
Yeah,
too.
that
You
would
know, on
be
their way,
actually,
they're there. It's a captive audience. Boost them up and get them out of there. That type of thing.
That's a good point,
Second
because
question.
we could actually have flyers, because if we have shots available, and hopefully we do, if we don't fully book out, we could just have a flyer to give them as they walk out. They could literally walk over and on the spot. We do have the capability to do on the spot registrations.
Okay.
so any
Second question
chance?
is,
Yeah, sorry, Dilip, go ahead.
second question, because this is supported by the greater boroughs, this thing, how come we aren't allowing other people from that conglomerate, so to speak, to participate in the flu vaccine at the senior center and in the town, right? Just Northborough, Southborough on Saturday, but Friday for just the Northborough residents and the employees of the town. Why not, Westborough, Southborough,
everybody.
and yeah.
Yeah, so what we started early, and I think we'll learn, and maybe what we do next year will be different. This year, between the greater boroughs really starting up and getting the nurses in place, we held a preliminary meeting with every health director and our nurses, and sort of said, what are your plans for flu clinic? Under the contract, each of the 4 communities can have 1 to 2 flu clinics, or up to 2 flu clinics in their own community. And that will be funded or paid for and done through the greater boroughs nursing contract. So for example, Boylston is going to have their own senior center clinic that they hold at their townhouse, and they're going to hold their family clinic at their elementary school because they have a regional high school in Berlin is not part of this group. So they're sort of Boylston's going to have their own 2 clinics for their residents. Southborough does have a little bit more robust of a health department staff, and they already had planned their own clinics. So they're Erin Shanahan, our public health nurse for the boroughs, is supporting their flu clinic. I believe it's tomorrow that they're doing in-house, and then I think they're doing employees. So we pulled together with Southborough just because our students all go there. So it'd be crazy to run a clinic at the high school and say, oh, but Southborough seniors and juniors and sophomores, all the rest, you can't come. So we are sort of partnering here to do that. And then Westborough, again, when we met early on, they were in a period of transition. And so at that point, they just said, we typically they don't have a history of running town clinics. So they weren't planning to do it this year. So I think Westborough, just given the timing and the grant just starting, didn't elect to do clinics with Sam and VNA. I think
I was just saying, I guess my point was, why not open it to the residents of the 4 towns? That way you have more options for appointments, right? Say this Saturday doesn't work for me.
Yeah.
Now I can go to Westborough if I'm on that. You know what I'm saying? If other towns there, so we could have potentially 8 different dates for the vaccination, which definitely gives people an option.
Yeah, and I think we'll probably do that. So I'll talk a little bit in a minute about our COVID clinics. We had extra appointments, and so those extra appointments for our Pfizer booster, we did distribute to the 4 towns. So we did say Westborough, et cetera. So Boylston, we sort of want to give each opportunity, because it's a first time, the opportunity to try to fill it locally. And then I think if we do have that availability, there'll be, we could sort of share those appointments. But I think this year's a little bit of a learning lesson, and every community has a little bit of that artifact. This is how we've done it in the past. And so I think the goal, what I envisioned if we talked about is, to your point, Dr. J, we would have a schedule of, here are the flu clinics across the 4 communities. Take your pick. It doesn't really matter which one you go to. But I think because Southborough is still using their own staff, and Westborough is still contracting with, I believe, Cheryl Orwinski helps to run one of their clinics. So we still have a little bit of that artifact, but I think next year I'm hoping it will be that larger vision, like you thought there. So we'd have more opportunities and dates for families and residents.
All right. Thank you.
Okay. All right. Okay. So just to continue, so now we're done with our flu clinic update. Just want to talk a little bit about our COVID-19 update. We'll cover our vaccine clinic. So as I briefly mentioned earlier, on Friday, we held a Pfizer booster clinic at the Northborough Senior Center. We administered 68 vaccines during that 3-hour clinic that was supported with the Boylston Fire Department, provided 2 vaccinators and someone EMT to help in the observation room. And we also want to give a big thanks to Sophia Wackel and Natalie Roberts. They're both new registered nurses, and they came to help out and vaccinate our seniors and our municipal employees at that event. So again, we had the ability to vaccinate a lot more. We just didn't have the demand. I know it was a quick turnaround with offering that booster clinic for Pfizer. I think a lot of our seniors in town may have already received the booster, either through the early approval in August for immunocompromised, or there is pretty good availability at the pharmacies right now. So we didn't have lots of calls about the Pfizer booster. I'm hearing a lot more demand about and questions on the Moderna booster. But it was great to offer it. So that was a success. We used the Color platform, again, the same registration tool. All the vaccinations were done like with each vaccinator on an iPad. So a big thanks to David Kane and our MIS GIS and our great technology in town. And that was successful and streamlined, and it just helped prepare us for these flu clinics and any future boosters. So again, I think for now, we don't have any more requests on Pfizer boosters. We aren't planning additional booster clinics at this time, and we're sort of really gearing up and thinking ahead and planning for the under 12 and Moderna boosters, if those are approved. So again, no additional clinics are planned by the Northborough Health Department at this time, but as we see those future approvals pending. So if you're following the news, you'd know that Moderna and J&J boosters are going to be discussed next week. I think the meetings are the 20th and 21st. I believe it's the ACIP. And then we'll have, there's going to be the first meeting to discuss the under 12 vaccine is scheduled for October 26th. So we don't anticipate any approvals, most likely this month for October. We'll probably be looking to be planning clinics for the month of November would be my guess. So any more questions on COVID-19 clinics?
Nope.
Okay, so just to touch upon testing. So again, COVID-19 testing, you may, if you drove by Northborough, the Ellsworth McCaffrey Park on South Street, we're getting some questions like what's going on out there. So just to update you, I believe the board received an email. So that location, the park, is being used in the mornings between the hours of about 6:30 to 9 a.m. as a satellite testing location for the Northborough Schools Test and Stay program. So again, that program is for unvaccinated in-school close contacts. They're doing rapid antigen tests. The state it's fully funded through the state. The state's providing staff, but they're only providing 1 to 2 staff. And so the reason Northborough Public Schools doesn't just do the testing at each individual schools, we have 5 schools. And so 1 or 2 people can't administer the testing for that. So it's been a great success. We've been over there. We've had Angie at our office and Diane Legier volunteered some of their time in the morning, just providing support. It's very efficient. They've tested up to 40 or 50 in a given day. I think tomorrow the numbers are a little lower, meaning there's not as many in-school close contacts. So maybe tomorrow they'll test about 20 students at that program. So again, they drive in, they wait in their car. The test is administered with the child in the car. They get their result, their little slip of paper that says you're good to go, and then they go on their way. So I believe we did have 1 positive coming out of the testing, but overall, we're not seeing a lot of positives. So that's a good sign. I guess masks and all the other measures they're taking at the schools are helping to prevent transmission. So that site should be set up, and we're anticipating to keep that satellite location set up. So you'll see that vehicle there. It's locked up, it's secured. I don't know if you guys have any questions about that program. And then just generically, I wanted to bring to everyone's attention, we do have a new COVID-19 free Stop the Spread site at the Ashlands MBTA station. So now we have 3 state Stop the Spread sites in our area. Again, Marlborough Hospitals on Monday, Tuesdays, and Thursdays from 8 a.m. till 1. Framingham is still offering the Project Beacon sites. I believe it's on Waverly Street. And that is, again, by appointment. It used to have a drive-through option. That is now a walk-in by appointment. Ashland, I believe, is a drive-through at the MBTA. And all of those sites and more information on testing in the area is found on the Town of Northborough's website. But a quick link is tinyurl.com/nborough testing. And so you can see information and how to register for those sites. And just another brief update. I know we've talked about the town of Northborough getting this rapid PCR machine for employees. We finally have that piece of equipment, and we're scheduling to, and I'll be reaching out to Dr. Sane to come take a look. I'm working on availability of the vendor to set up the machine and just set it up for our training. So again, that is really a tool we have locally. In the event we do need to get rapid PCR for municipal employees, first responders, we're sort of going to pilot that and see how it goes. The tests are expensive. Those tests that we did pre-purchase are through CARES Act. They're $41 a piece. So, you know, again, the machine runs one sample at a time, and it takes about 15 minutes or so to run that sample. So it's a great piece of equipment. It's a great way that we can use it. It's going to be shared regionally with each town purchasing their own individual kit. It will let us to, you know, respond to, test, and deal with difficult situations and availability of testing. But it's not a robust, you know, multiplex system that can do multiple samples. So it's not a piece of equipment that would be akin to some of these other sites where they're doing, you know, hundreds an hour, et cetera. So any more questions on testing?
Nope.
Okay. So I think last for me on our COVID-19 update, I just wanted to bring to light some recent case counts. I did ask for Erin Shanahan, our public health nurse, to run some of the numbers. We've definitely seen a huge uptick. In the last month, we've had over 100 cases in a 1 month period. So we're thinking back to like last December when we really saw those high numbers of cases.
Yeah.
So, you know, really big surge. We've been flat out. So some of the public health nursing goals we had set for Erin have sort of been put on the back burner while she's making lots of contact tracing calls. So in retrospect, I just had Erin pull the numbers for about the last month or so from, let's say, September 10th to October 10th. In 2020, we had 27 cases in that same 1 month period. This year in 2021, we're seeing in the same 1 month period 121 positive cases. So what is that? You know, nearly fourfold increase in the number of cases we're seeing in town. The good news is we have high vaccination rates, you know, overall. And so those vaccinated people that are getting COVID aren't getting sick or ill from it, and they're, you know, not being hospitalized at the same rate. So talking about breakthrough cases, so a case where someone is fully vaccinated and then actually does get COVID or test positive for it. So just to run the numbers and look at it again. So of those 121 cases we've seen in the last 30 or so days, 54% of them were vaccinated. 24 of them were under 12 and not even eligible. So when you really say how many vaccine eligible people, you know, had the cases, we had 97 eligible cases, and 54 of those cases of the total cases were breakthrough. So we're seeing about 50% of our cases in our 12 and up are breakthrough cases, which is pretty consistent with what the state is reporting as well. So a lot of, you know, there's a lot of conversation about why are the schools still wearing masks? We have such high vaccination rates. And I just wanted to show you that the numbers that, you know, there is transmission happening even among the vaccinated. Again, the good news is they don't get as sick. They're not hospitalized at the same rate. Serious illness is down, but transmission is there. So, okay. So I think that is the end of my slideshow. I'll just pull that agenda back up quickly. So I guess, Mr. Chair, we're on to any other business unless you have additional questions on the COVID-19 update.
So Kristen,
Dilip.
yes, thank you, Mr. Chairman. So a lot of the towns are going to, again, indoor mask mandates again. Is Northborough considering this? Right now, I know in Marlborough Hospital, there are like 10 cases in the hospital with COVID, which is huge, you know, considering the size of the hospital. Some of the surrounding towns have gone to full indoor mask mandates. Is this something that we should consider, or? I mean, I know they have it in schools, et cetera, but other places, you know, it's not fully there yet.
The only town I'm aware of, like Metro West, and I'm sure there's some more. I know Sudbury passed the indoor mask mandate.
Shrewsbury has it now too.
Now Shrewsbury in all buildings. Okay, so
All indoor.
okay, so
grocery
it's not
stores.
just municipal, they're doing private
No.
as well.
Grocery stores, gyms, workout areas, yoga studios, it's all indoor mask mandate. So I mean, I know Worcester has it, and of course, all the bigger cities are starting to put them in there as well. So I'm just wondering, because of the uptick, is that something we need to consider? As much as I don't like suggesting it, but the Board of Health is the one that passed that in Shrewsbury
Right.
last week. I think it was a week ago or 10 days ago. So I just, I bring that up for discussion here for us.
I know I had a personal experience this weekend. I was in Provincetown, and they do have an indoor mask mandate. Like, there was the big outbreak this summer, and I don't know if they kept it in place or it came out. And it just was a personal experience. I was in a Dunkin' Donuts. It was really busy. I was wearing my mask while there was, and it was required. It was clearly posted on the door. And I just think one thing that just really struck me, and I'm not saying I agree or I don't, but you just realize how this filters down. The store was totally overcrowded. They were understaffed, and at the cash register, a woman was trying to not only take orders with this huge back of the line, but she's also trying to politely instruct the gentleman at the very back of the line who wasn't wearing a mask that, you really need to put that on, sir. And I saw the look on his face, and, it was a personal experience where I really felt for that clerk, right? Because we can pass a mandate, but I can't be there to support every clerk. And, and there is a lot that goes into the employees, and we do push the burden onto the business. Our police department can't be there, and so I just know the experience I've had when I talked to the health director in Sudbury, that they were getting a lot of kickback about their mask mandate. It was affecting their ability to keep up with the operations of the health department because they're just responding to complaints. And so I don't want to, I'll leave it to the board, but I just think it's a bigger issue. It puts a lot of pressure on different people. I know our numbers are up. Where are we in hospitalization, available beds, and that sort of thing. And trying to look at that big picture, I don't know if we really have enough data to make any decision, right? It would be, whether or not we want to continue to pursue that. But there's so much confusion with people, right? They go town to town, and it's required here and it's not required there. And we have had businesses inquiring with us, wanting to know if it's something we're going to consider because it affects, decisions and their planning. So I just think it shouldn't be taken lightly. And not to, I think there's a lot to think through, and maybe even talking to other communities that have enacted it to say, is this working? Are you really seeing your numbers going down? Is transmission, reduced as a result of this? And that's something we could definitely look into to gather that more information. But it was a difficult experience seeing that woman, in Dunkin' Donuts trying to, enforce it and do all the right things. It really just gets pushed on and put people in uncomfortable. I wish we could support them more. But, we've been through it before, but last time I think it was a state mandate for the masking. Did Northborough? It never went to that level because the state jumped in, I think, right about when you guys were getting ready to review mask mandates.
I don't know. I think, excuse me, it might be a wait and see. Excuse me. I don't think we're prepared to act on this tonight unless some of the other board members want to chime in on it.
No, I agree with Dilip. When I go in whether it's a grocery store or dry cleaning store, I am putting my mask on. And I think every responsible citizen has to do it, whether they're vaccinated or not, especially if they're not vaccinated. But I think enforcing that, I agree, we might need a little more support probably at least from the surrounding towns. I think if Shrewsbury has passed it, Worcester has, and we can wait and watch how the other Southborough, Westborough, if they are planning to, probably we should definitely
Well-
consider it.
I think Boston went back to it, did they not?
Boston,
City of
Somerville,
Boston.
Cambridge. Oh yes,
Cambridge,
they
yeah.
all have Framingham. They're all, mandatory, and all the businesses have the signs posted now. It's not their decision; it's taken out of their hands.
Right.
So, the fact that the town is mandating it gives them some additional, this thing. Again, yeah, I'd love for all of us to get back to normal life, but I think we also have to look at what's happening as the numbers are going up. We're entering the flu season, which is going to be a whole nother issue.
Yeah.
And if there's one thing, last year, if you realize, last year the actual influenza cases were so minimal because everyone was wearing a mask.
Even
I mean,
other
that was the
viral
only-
infections.
Yeah, all the viral infections were low, so
Yeah.
kids were not out of school. You know what I'm saying? So
Yeah.
it does make a difference, as much as we don't like to wear it or whatever it is. But as Swati said, when I go to the grocery store, I'm wearing a mask. I don't worry about the next person in line who may not be wearing a mask, may not have been vaccinated. I mean, we don't know that. It's not a tattoo that we carry on our forehead. But if we're going to behave responsibly, then I think that's what we need to do. Again, I'm not saying we should pass it right now. I'm just saying we need to be aware of what our surrounding towns are doing. Take that into account when we're doing that. Maybe not be at the forefront of that decision, but definitely we should be keeping track of the towns around here. I mean, I get the information about the hospital, and I do the search on the websites of the other towns to see what their board of health are doing, and get feedback from them. That's I just want us to be aware of it, not necessarily pass it now, but if next month we see that 121 go up to 251, then we might
Right.
want to be a little bit more serious about that, because that's we have to protect our citizens.
So right now, employees in Northborough and in various establishments do not have to wear a mask, correct? Is that the status?
Right, so it's up to the private business. In Northborough municipal buildings, yes, they do. So I'm not wearing, I'm seated at my desk.
Right.
Katie's in a traffic flow area over there. You can see she's wearing a mask. So Northborough does have a requirement, for any visitors, or as soon as you're up and away, if you're everybody wears a mask when they're away from their desks. And we're even trying to, reduce, in-person meetings and larger gatherings. So we're definitely doing it at the town level. The schools have their own requirement,
Schools have
that
it,
was
right.
set through the state. I know the medical advisory team is making recommendations to not support applying for a waiver, I believe, at this time. So that will be going forward, given the high numbers, right? The numbers are sort of just fourfold where they were last year in terms of the schools, like tenfold in terms of the younger students, right? Delta is more transmissible among children, than previous strains. So I think we're all very aware, but yeah, so if you're a private business in town, you might set your own rules. But there's no requirement, that's coming from above, from the municipal or state level.
I don't think the state's going to require it. From what I've been hearing and Governor Baker on down, it doesn't seem like they're going to jump on that mask mandate again. So it would be up to the towns. 54 breakthrough cases is disturbing. Certainly is. Now, the 54, do we know how many, if any, had to be hospitalized or?
I don't have that at my fingertips. I know that, again, vaccinated, I think the rate of hospitalization is like 1% of the fully vaccinated, so it's
Right.
very low rates
Low.
of serious illness, so there's definitely a reduction there, and we're not seeing as much of it. But there have been, severe illness and death of fully vaccinated people recently. You're hearing about that. So the numbers are there, but again, proportionally, there's so many people vaccinated in Massachusetts, there's going to be some of those numbers. But it is something to take seriously. I think it's important to spread the word because people are getting back into that habit of having larger parties, or maybe I'm going to have a large Halloween party. This is still the year you want to have it outside, right? Because you don't want everybody to have to, because you still have to, vaccinated or not, you still have to isolate, when you're sick, and that runs through a household. We're seeing high transmission rates in households among vaccinated. And so, if the way it spreads, sometimes you have a whole household that's knocked out with somebody home isolating for a whole month, as it works its way through the family. And that takes away from student learning. That takes away from people's ability to get to work. So, we want to really find a way to encourage the public, get that information out there, tell people to wear their masks. They're effective. And we want, the community to be able, we don't want to go back into lockdown or overwhelm our hospital systems. And, it's getting even harder to the point of the flu, all the symptoms are very similar. So, I think we're all anxiously approaching the flu season in the fall.
So the field hospital, DCU, is opened up again.
Oh,
Okay.
okay.
Yep. So
Didn't know
DCU Field Hospital has opened up that center again after being closed for almost 8 months. So, the numbers in Worcester have gone up. ICU beds are very few, if any, available. So, I mean, as I say, we have to look and see what's happening as more and more people are moving indoors for gatherings, because of weather and whatever else have you. You're going to see that uptake. And like I said, DCU Center has opened up again for the overflow from the hospitals. And that's not a good sign for whatever it's worth.
Kristen, is there a maximum number of people that can get together indoors?
No.
Get together or nothing?
Not
now?
yet.
There are no restrictions
No
whatsoever on
restrictions.
gatherings.
Not yet. Not
Yeah.
like last year where it was 25.
Right.
Right. And up
Okay.
to 50.
Because that is
Yep.
concerning too.
Yeah, that's the problem, right?
Because right now is a season of, gatherings for a lot of different cultures and religions.
Yep.
So,
Yeah.
And so I think by our next Board of Health meeting is, tentatively be scheduled for November 9th, we'd be starting to see some of the numbers of the Halloween activities coming through, like that 5-day mark. It would just be like right at the cusp. So I think by that time we'd have a much better, and if we were, action was needed, it would probably be prior to the holidays really kicking off with the November, December holidays.
Thanksgiving is coming around.
mm,
I think it's a good idea to take this up at the next meeting.
Okay.
And consider it. We'll see what the science is telling us.
Yeah, I mean, everything's going to depend upon the numbers, how they are, right? If next month
Right.
Kristen comes back with horrible numbers, at that point in time, I think our decision is going to be forced upon us, basically.
Right.
So we could put that as
Public
a
health.
tentative agenda item for the November 9th.
Yes.
And maybe, Dr. Jane, you're following this pretty closely. It seems the
Yeah,
numbers, if
I'm
you
gonna-
want to touch base, that we could maybe touch base the week before to try to compile some
Sure.
of that information. So,
Sure.
the board can
Yeah.
weigh that. And maybe I in the interim prior to that meeting, can also reach out to the Shrewsbury Health Department about their recent decision to see where things stand on that too, just to provide more
Yeah.
information about the reality of, implementing this locally.
And we'll see
Yeah,
what Worcester does.
Yeah, they did put their numbers on the website. I don't remember them
Yeah.
right off the top, but Shrewsbury did put the numbers up. It was significantly higher.
Okay. Well, that's a good one. Thank you, Dilip.
okay.
Onwards and upwards. Anything further? We got our tentative date scheduled, November 9th.
So I just wanted to announce the board, very exciting news from the town administrator's office. We have an appointment of a new Board of Health member. Her name is Lisa Johnson. I interviewed with her and John Cordair last week, and I don't think I could have invented a more perfect complement to this board. So Lisa is a long-term resident in town. I want to say over 20 years. I know she had John beat by a couple years. Her kids are up and grown up. They went through the Northborough public school system, so she's familiar to town. And the exciting thing is she comes to us, and I don't want to speak to all her experience. I'll forward the resume, but just a brief summary. So she comes to us with a master's in public health, and she's also certified in public health. So she has her CPH. And she is also holds a certified health education specialist certificate. And she's also a second-year student in the Doctor of Health Science program at Mass College of MCPHS University. So she's coming from a more academic standpoint. She actually teaches MPH or Masters in Public Health courses at the MCPHS. And so those courses are really around health programming. So Lisa really perked up and was excited about our new Greater Bowers partnership and the health programming we're trying to bring to our seniors. So I think she is going to be a real welcome addition. The appointment just happened actually today. That's, I think, why you didn't see that email yet. I'll forward that to you. So not enough time to swear in, but I think Lisa is planning to meet all of you at our next meeting in November. So
Great.
excited
Excellent.
to have her on board.
So now we'll be a full complement.
Yeah.
5.
Yeah.
Went from 3 to 5. That's a good thing.
Jamie Terry has finally
Finally got her wish.
seen it come to fruition.
Is it an in-person meeting or is it a Zoom meeting?
I think with these numbers, we'll stick to Zoom. I don't know. And
Yeah.
also the holiday chaos, if that works.
Yeah,
Leave it to you.
it works.
Okay.
All right. Anything else? Well, that's exciting. If there's nothing else, I'm going to move to adjourn the meeting.
Second it.
Dilip seconds it. All those in favor?
Aye.
Swati
I'm in favor.
Teresa?
Yes.
Yep. Aye.
and myself. We're good to go. Well, thank you, everybody, and we'll see you on the other side of October.
Stay